To Georgia, Minister Zurab Azarashvili, please come forward. He's the Minister of Health, Ministry of Internally Displaced Persons from the Occupied Territories, Labor, Health, and Social Affairs of Georgia. It's our pleasure to welcome him to the podium.
Prezentaci. Dear Dr. Ward, dear Dr. Alter, ladies and gentlemen, distinguished guests, first of all, let me express my sincere gratitude to Dr. Ward and Dr. Alter for arranging this very important meeting and inviting Georgia to join the initiative to form the United Nations Group of Friends for Hepatitis Elimination. I have pleasure to speak about the Georgian model of hepatitis elimination. So Georgia is a small Eastern European country with a population of 3.7 million and briefly about HCV epidemiology in Georgia. Population-based survey in 2015 showed that 5.4% and about 150,000 persons had chronic HCV infection. In April 2015, in partnership with the US CDC, with technical support of WHO and commitment from Gilead Sciences to donate its direct-acting antivirals, Georgia launched the world's first hepatitis C elimination program with the goal of reducing prevalence to 90%. I would like you to know that Dr. Ward was the first to come up with the idea of eliminating hepatitis C at the WHO Global Partners meeting on hepatitis in Geneva, March 2014. Thank you for that, Dr. Ward. Dr. Ward's contribution in the initiation and the implementation of Georgia's HCV elimination program is outstanding. He was the first leader of our program from the American side. Let me remember with great respect former president of Gilead Sciences, the late Mr. John Martin, an outstanding scientist, great person, and a good friend of Georgia. Without his personal effort, Georgia's program would not have been possible. The program was officially launched on April 2015 when the government of Georgia and Gilead signed the memorandum of understanding by which Gilead committed to supply the elimination program with sofosbuvir, velpatasvir sofosbuvir, free of charge for us. US CDC, Gilead Science, ECHO project, WHO, of course, Leifer Goethe Business School of Frankfurt, and Royal Free Hospital London stand as international partners in Georgia's HCV elimination program, providing research and practical guidance in surveillance, treatment, and other directions. Georgia HCV elimination program differs from the expanded treatment access programs of most other countries, where treatment is generally provided to patients who know their HCV status and who refer to clinics, while Georgia's program builds on active case finding through various interventions. One of the best demonstrations of active case finding is an innovative project on integrated screening and detection hepatitis C, tuberculosis, and HIV infection. The project ensures active case detection of HCV at the primary healthcare level through large-scale screening, including door-to-door outreach. There are 40 clinical sites throughout the country, including 10 primary care centers. And now the results of the program as of the end of July 2022, from 2.8 million adult population of the country, about 2.5 million persons have been already screened at least once. From more than 150,000 anti-HCV positive patients, about 98 patients had chronic infection, HCV infection. More than 80,000 patients started treatment, and cure was achieved in 99% of patients. In 2018, Georgia started decentralization of HCV treatment and care services using simplified diagnostic and treatment protocols in primary health care and harm reduction facilities. HCV treatment and care data in these settings are very promising. Nationwide integrated decentralized model of HCV treatment has already significantly improved the linkage to care in HCV cascade. So here's the remarkable progress. The follow-up national HCV seroprevalence survey conducted in Georgia in 2021 under supervision of US CDC showed a significant decrease of chronic hepatitis C prevalence from baseline 5.4% to 1.8%. This is a remarkable progress of our program and ensures the perspective of HCV elimination is really achievable by 2024. COVID-19 pandemic has negatively affected access to HCV screening and care services in Georgia. Namely, compared to 2019, there was about 50% drop in HCV screening in 2020, as well as slowing down of patients' enrollment in treatment program over the last 2 years. Intensification of countrywide testing on HCV infection, integrated HIV, HCV, TB screening and detection program, as well as intervention for improving linkage to hepatitis C care, including expansion of decentralized services, have already strengthened. Challenges remained in linking HCV infected persons to care, namely about 14% of persons with anti-HCV positive results have not referred to HCV providers for testing and treatment. About 15% of persons with active chronic hepatitis C have not initiated treatment, unfortunately. However, effective linkage strategies have been already implemented, namely dedicated staff from national CDC have been reaching these patients and encourage them to be engaged in treatment program. So Georgia has a unique opportunity to become the first country to end two major epidemics of the 21st century, HIV, AIDS, and hepatitis C at one time by 2025. I would like to acknowledge CDC, Gilead Science Technical Advisory Group, WHO, LIFER, ECHO Project, and all HCV clinical care providers. Thank you for your attention and let me cordially support the formation of UN Group of Friends. Thank you.